Good afternoon. My name is Chris Rowena, Lead Communications Analyst at Health Workforce Development. We're excited that you have joined us today for the Psychiatric Education Capacity Expansion, or PEACE, Psychiatric Mental Health Nurse Practitioner Training Webinar Program, informational webinar. Before we begin, I would like to discuss a few housekeeping items. Number one, our webinar is hosted in Microsoft Teams. If you are not familiar with the platform, you can find the view controls and the chat feature in the menu bar at the top of your screen. Number two, the webinar will be recorded and posted on our website in approximately 7 to 10 business days. And number three, today the chat option will be open for asking questions during the Q&A session, which is at the end of this webinar. Due to an issue with Microsoft Teams platform, we ask that you do not use the Q&A feature and instead use the chat function to ask your questions. Thank you for your understanding and cooperation. Here's today's agenda. We will have some opening remarks from our Assistant Deputy Director, Dr. Sharmil Shah, followed by an explanation of the PEACE program by Program Officer Mohammed Arshadi, and then we will open it up for question and answers. And with that, I am thrilled to introduce Dr. Sharmil Shah.
Thank you, Chris. Good afternoon, everyone. Thank you for joining us today for the Psychiatric Mental Health Nurse Practitioner Training Program webinar. I am Dr. Sharmil Shah, the Assistant Deputy Director for the Office of Health Workforce Development, and it is my pleasure to welcome all of you. There is definitely a growing need for psychiatric mental health nurse practitioners. In recent years, there's been a shift toward raising awareness of mental health overall, including mental health disorders, and eliminating the stigma that stubbornly persists when seeking help. Experts believe that mental health nurses can play a critical role in addressing the unmet need for care and collaborating with primary care physicians to provide a more well-rounded system of care that focuses on both physical and behavioral health. You, as educational and/or medical institutions, play a critical role in developing and expanding psychiatric mental health nurse practitioner programs that train and prepare them to serve our communities. But before we jump into the content of this webinar, I wanted to ground us a bit in the mission of our department. HCAI expands equitable access to quality, affordable health care for all Californians through resilient facilities, actionable information, and the health workforce that each community needs. Next slide, please. The way we do that is through the Office of Health Workforce Development. We support and increase a health workforce that serves medically underserved areas, represents California through its racial and language diversity, and serves Medi-Cal members. We also do that by offering programs that provide financial support for organizations expanding educational capacity, for individuals to pursue health careers through our scholarship and loan repayment programs, and to organizations to help build the workforce pipeline. I wanted to take a few minutes and just give you a little bit of an overview of the PEACE PMHNP training program. The purpose of the program is to increase the supply of psychiatric mental health nurse practitioners trained to work in California, with an emphasis on serving Medi-Cal enrollees and those in underserved communities. Next slide, please. The program goals are to increase the number of underrepresented individuals in health professions training and practice, create a more equitable workforce geographic distribution across our state, and support cultural and linguistic diversity. Could we go back one more slide? Sorry. As we'll describe the services, adding these slots to an existing training program creates a new training program. So we want to train psychiatric mental health nurse practitioners to work in underserved communities, and it would also include training for serving children and youth through age 25 and their caregivers. Next slide. Our guiding principles are to provide care that is client-centered with priority on early intervention, provide care that is child and youth-centered, also with a priority on early intervention, ensure racial diversity, cultural humility, and a linguistically competent workforce. conduct outreach to and engagement with the unserved, underserved, and inappropriately served, and use effective, innovative, evidence-based, and community-identified practices. Promote wellness, recovery, resilience, and other positive behavioral health and primary care outcomes of children and youth and their families, and include the viewpoints and expertise of persons with lived experience. We want to ensure that we work collaboratively to deliver individualized, strengths-based, consumer and family-driven services that promote interprofessional care by working across disciplines. And HCAI expects these guiding principles to be used by all of our grantees to inform their educational materials and training. I would now like to turn it over to Mohammed Arshadi, our program officer, to tell us more. Thank you.
Thank you, Dr. Sharma for that introduction. Good afternoon, everyone. Thank you for joining us today for this webinar for the PMHNP program. My name is Mohammed Arshadi. I'm the program officer for this program, and I'll be going over some important details regarding the program. Next slide, please. Yeah, so first I wanted to go over some key dates. You don't have to memorize these necessarily. These will be on our website too, but if you want to take note of them, that's probably a good idea. The application became available on February 23rd, 2024 at 3 p.m. The technical webinar, which we're in right now, and then application submission deadline will be on April 8th, 2024. And then anticipated award notices date will be on June 30th, 2024. And probably we will have the grant agreement start date to begin on July 1st, 2024. Next slide, please. The funding for the programs, so the program is sections into two parts, new programs and those who are expanding their existing programs. The new program funds are to be used to obtain national accreditation and State Board of Registered Nurses approval of programs. And then the program expansion, for those who are expanding their existing programs, funds are to support operational costs associated with the training of additional students. The allocation of funds to each grantee will depend on application evaluation scores and geographic coverage across California. Thank you. Next slide, please. Regarding the new programs, the grant period for new PMHNP program is 3 years. Funding is for universities to establish new programs through securing national accreditation and state BRN approval by June 30th, 2027. So that's by the end of the grant agreement, basically. And HCAI will release grant funds in 3 payments. So 25% of that payment when grant agreements are executed, 25% upon completion of select phases of work. And you can see the grant guide for those phases. We also are going to put a link included inside the chat that will show the different phases and the links that you'll probably use to review the grant guide, which will have more information and everything I'm explaining. And then lastly, the balance of funds will be released based on a measurable progress toward full certification and BRN approval. Thank you. Next slide, please. For the expansion programs, the grant period for PMHNP program expansion is 5 years. The first year of the grant may be dedicated to developing the expansion, including hiring faculty and field supervisors and recruiting new students. And then funds will be paid annually for expenses incurred. And let me open up a parenthesis here. By that, we mean the annual reports that we will provide the link for that. It will become available, so you don't have to really basically email us about that. We will make a link available that you can submit your annual report. Next slide, please. The award section, non-supplementation grants must be used to supplement existing funds and not to replace funds the grantee has received from another source for the same purpose. Administrative and indirect costs shouldn't be included in this grant. Grant funds cannot be used for administrative or indirect costs, which are built into the grant award. The award levels. HCAI may award full, partial, or no funding to an applicant based on the applicant's evaluation score and the amount of available funds. And then lastly, well, not lastly, but geographic distribution. Award decisions will depend on application scoring results on geographic coverage across California. Next slide, please. And then now we get into basically the application process. So there's components to the application. You will view these components within a technical assistance guide that we have put together. We will make a link of that available. And once you visit that link, basically it will go through every step of the application process that we're about to explain here. Thank you. Next slide, please. Yeah, so the application components, they consist of general information, would be probably the first thing you would view, and then profile information, which includes creating a profile and the details to that. And then we have program information, which you may explain what your program is intended to do. Contract administration. And then we have the program data. Depending on which route you pick, whether new or expansion, then you would have other fields such as field practicum sites, faculty qualifications, and then you would have the next section, which you would talk about the budget you're putting forward for this program, recruitment and other strategies. And then lastly, you would have required documents that need to be uploaded that you would get asked probably in the beginning of the application, and you would upload those at the end. Make sure those are in PDF format. And then finally, if you're doing an expansion program for PMHNP or you're expanding an existing program, you will have another component which will talk about the students' demographics. And you only see that if you're expanding your program. That step is also included in it. Thank you. And then some requirements regarding the application, which again will come at the beginning. When you're submitting, you would have to submit a letter to the Commission on Collegiate Nursing Education, CCNE, seeking accreditation. For expanding programs, accreditation letter is a requirement. And then submit a letter of sustainability, committing the sponsoring organization to support new or additional training slots when the HCAI grant ends. You will list your current and or proposed field of placement sites. And then finally, you would submit a California Board of Registered Nursing BRN letter of approval, and that would be if you're expanding an existing program or you're applying for expansion. Thank you. Now, regarding the budget for the new psychiatric mental health nurse practitioner training program, the eligible programs may receive an award up to $1 million. And then if you're doing an expansion program for an existing PMHNP training program, programs preparing nurse practitioners for PMHNP certifications are eligible to receive $33,000 per filled slot in this one-year program, which is for the certificate program, of course. And then psychiatric mental health nurse practitioner training program are eligible to receive $100,000 per first-year slot for 2- or 3-year programs. Thank you. Next slide. And here are some payment provisions. Again, this will be part of the phases I was talking about earlier, and this will be included in the chat so you can see it as a snippet if you do forget these. HCAI expects the grantee will begin performance of the grant agreement on the start date listed on the grant award documents. The State Controller Office, which is a separate department from ours, will mail a paper check directly to the grantee's address on file. And then I'd like to stress that make sure that your address for your business or where you're supposed to receive payment matches with your IRS records. We will ask for these on a paid data record form later on provided to you with your grant agreement, which is the SCD 204. And make sure just all of that information matches. This is to basically prevent any delay in payment for you folks. HCAI cannot provide tax advice to grantees. HCAI are not tax professionals, and tax consequences may vary depending on the grantee. For this reason, grantees should seek professional tax advice. Then HCAI reserves, moved along a little fast. HCAI reserves the right to recover monies for grantees' failure to perform services and other grant agreement obligations. So that means if something doesn't go according to the grant agreement or the agreement you have between you and HCAI, we reserve the right to take any part of the funds back. Thank you. Next slide, please. And this is the evaluation criteria here we are viewing. This is for both programs, expansion and new programs. Evaluation criteria include the following themes: % of patients served who primarily seek Medi-Cal threshold languages, HCAI mental health score based on location of rotation sites, proportion of children and adolescents served by PMHNP students, % of rotation months in rural areas, cultural and responsive care training in the program's curriculum, and then payer mix, which will include Medi-Cal, Cal or Medicare, and uninsured payers. And then lastly, HCAI also intends to support a geographic distribution across California. Now these, I just wanted to quickly mention that the evaluation criteria is something also found in the guidebook. You don't have to, I know this is a lot of information. We don't expect you to memorize all this. So if you want to later on go through those, we will provide links at the end of this presentation that will take you to these sections. Thank you. Next slide, please. And this is more of the scoring. So how we score the applications for expansion programs. Evaluation criteria include the following themes. Payer mix information is a percentage for 12 months for the calendar year of 2023 that we will be looking at. The mental health HCAI severity, facilities in rural areas, number of patients served at the site and in the previous year, or number of sites or site that you have that how many patients they served. Percentage of listed Medi-Cal threshold, endogenous tribal and sign languages spoken by current PMHNP program students. And then the last three bullet points, these will be presented to you in terms of multiple choice options, so you don't have to narrate these, but basically what strategies you will use to recruit and support PMHNP students from underrepresented communities, what program strategies you will use to encourage your PMHNP students to practice in areas of unmet need, and then what strategies you will incorporate to implement culturally responsive care training into the program's curriculum. And that's the gist of the scoring for the expansion program. Next slide, please. For those who are applying for a new PMHNP program or training program, the scoring will go according to the list below. Evaluation criteria include the following themes: number of first-year PMHNP students you will enroll for each academic year, and some of these you might catch that are similar to expansion program, and facilities in rural areas, what strategies you will use to recruit and support PMHNP students from underrepresented communities, what program strategies you will use to encourage PMHNP students to practice in areas of unmet need. And finally, what strategies you will incorporate to implement culturally responsive care training into the program's curriculum. Thank you. Next slide, please. And then these are the annual program reports I mentioned a couple of slides earlier. So we require these based on annual basis, and then we will provide, again, the link so you can submit those to us. And the reports are due by July 31st of each grant year, or at the end of the fiscal year. Reports include number, and these are some of the things that the reports may include: numbers and socio-demographic characteristics of applicants and admitted students, and then HCAI values and principles in training materials, expenditures and changes in annual budget within the total grant amount awarded. And then HCAI will send grantees an online, as I said, form annually for collecting the required information. Thank you. Next slide, please. And then these are the links or resources you can check out, and I strongly encourage you to do that, mainly because the grant guide will have all the information we went over today, and also beyond that in detail regarding any kind of key dates or general information about the program, also copies of the grant agreements, how would they look like to you when you receive one, if you're awarded and you receive one. And then the next link we have here is the technical assistance guide. It will walk you through every step of completing an application for a PMHNP expansion or new program. They're all provided in one link, and then the TA guide will help you with every step of that. And then finally, we have a link here for the online application. And I encourage you to, before you view the online application, go over the 2 previous links first so you can get more information before you start that. Thank you. Next slide, please. And again, to repeat, the application is open right now. If you feel confident, you can start at any time, and then this will close on April 8th, 2024. For more information, also all the links in one place, you can visit the Behavioral Health Program webpage mentioned here. That will also have other programs included in there, so don't confuse them with the other programs if you're applying for PEACE. And then finally, if you are not sure if this is the right program for you, you can always visit the HCAI funding eligibility tool, which is the last link mentioned on this page. And this will basically ask you questions around what type of funding program you're looking for in order to direct you better to other funding programs we have available with HCAI. Thank you. And with that, I would like to thank everyone for tuning in. Sorry if I wasn't the most pleasant voice you've heard. And if you have any questions and answers, we're going to get into that next. With that said, I will hand it over to Christopher.
All right. Thank you so much, Mohammed. As
No
you can
problem.
see, our team has put a lot of work into this program, and we're excited that you've joined us today to learn more. We're going to transition to our question and answer session, and the chat option is now accessible in the menu bar at the top of your screen. Again, due to an issue with Microsoft Teams platform, we do ask that you do not use the Q&A feature. Instead, please use the chat function to ask your questions. We will answer the questions in the order that they are received, and we'll do our best to answer all the questions you have today. And with that, let's open it up to your questions. All right, we got our first question here. Thank you. All right, this question: will the facilities workbook Excel sheet, which includes payer mix information, demographics, languages, etc., be required for new programs this year? It was required in the previous application cycle. Oh, you're on mute, Mohammed.
My apologies. Sorry, Chris. Yeah, I wasn't sure of the answer to that question. If Clinton wants to take over or Anne, either one. Thank you very much.
Clinton's got it.
Hi, everybody. My name is Clinton Rousset. I'm the program manager. Yes, that information will be available, but it won't be on an Excel sheet. Our process is now on the eApp site, and so that'll be available when we do our annual reports. So we'll make that available to you. So new and improved, things are getting better, so it won't be just an Excel sheet anymore.
All right, thank you, Clinton. All right, and thank you for that question. Let's keep the questions coming. We've got all right, Stacy, thank you. Are the resources made available to navigate payer mix information?
Hi, this is Clinton again, the program manager. Yes, we have resources to help guide you through this process. One of the important resources we made available to you is the TA guide, which is on our website. It's also been posted to this chat, and so that'll help you a step-by-step process on navigating through the application. And we also provide a little bit of insight and coverage in our grant guide too. So if you'd like to use that as additional reference, and we've also posted that to the chat as well, that is available to you.
All right, thank you, Clinton. And for those trying to find the resources in the chat, up at the top of the chat box, you can see we have pinned that post, so you can just click on the little pin icon at the top. It says Alma Gutierrez, and that will open up that all of those resource links for you. Next question. The word residency is on the evaluation criteria table on page 16 of the grant guide for the PMHNP new residency program. Is this a typo, correct?
That is most likely a typo. Yeah, for PMHNP, we don't refer them to as residents, they're students, yeah.
All right, good catch. Thank you. Next question. Can a new program who has applied for BRN approval awaiting final decision by May apply now? Good question. Anne, is that one that you would field?
Sure, I'll take a try. So I think what matters is whether or not you believe you'll have that BRN approval by the time we make decisions as to if your application will be approved. The deadline, it's really tight in that the application closes on April 8. We require the letter as part of your application. So if you don't have it by April 8, unfortunately, it will not be, you will not be eligible for expansion. And the dates are on page 11 of the grant guide.
All right, thank you, Anne. All right, these are good questions. Let's keep them coming. I do want to mention too, if we get to the end of this program webinar and you remember the questions that you wanted to ask and weren't able to get them, you will be able to send us an email at bhprograms@hci.ca.gov, and we'll be able to answer your questions there as well. But we have the experts available right now, so if you've got your questions, let's keep them coming. Next question. Let's see. We're in the same situation as Dr. Jody, as we believe this is when the BRN may be voting on BRN approvals. Okay. So much a question as a comment. Sounds like there's a few of people in that situation. There are both expansion and new programs in this, correct?
Yes, that is
Yes,
correct.
Yeah, sorry.
Oh, sorry.
So those that don't have their BRN letter by the time would be able to apply as a new program. Is that looking for the clarification, I think, of what they're looking for?
I believe when we looked at the application, the BRN is for the expansion programs. It would require that and a letter of sustainability for the new programs. Yeah, but if I'm not complete on that, somebody can correct me, but that's the last thing we were going over actually right before the meeting.
So it sounds like these programs might want to apply as a new program.
Hi, this is Clinton again. Yes, these folks are in the new program category. If I may ask, if there's anybody out there listening, is there anybody else in the same situation? If we already have two, I'm just curious if we could take a tally. If you believe you're in this situation, can you make a comment in the chat?
Yes, that would be very helpful. Thank you, Clinton. Give people a chance to get their replies or their questions in. All right, so Stacy asks, so to clarify, a new program is okay to apply even without the BRN letter, as long as the sustainability letter is submitted?
Yes, that's correct.
All right, great question, Stacy. Thank you. Did mention, make sure that you have found all of the resources on our webpage. Again, they are linked at the top. We have the grant guide, the technical assistance guide, as well as the application. And then you can see in the chat, the table for new programs to help choose which pathway you would be on. If there's any more questions on that, please make sure We get those in when we have all of our subject matter experts online today. All right. Give people another minute or so to see if they can think of any other questions. Yeah, it looks like maybe we've already answered all the questions we've got today. So, all right. Well, again, if you do have a question that you think of later, please make sure that you email us at bhprograms@hci.ca.gov. Thank you all for your participation in the Q&A session. We are happy to stay on. We have more time available in this webinar, so if you do have a question, get it in there. But it's always helpful to have your guys' feedback and questions. They really help us make sure that we're providing the best service possible for our programs. Looks like we've got one more coming. All right, thank you, Dr. Jody Sandhu. As a reminder, we will be posting this recording and the slide deck on our website in approximately 7 to 10 business days. And so you can be looking out for those. And now Dr. Shah will provide some closing remarks.
Thank you, Chris. Thank you to our grants team, and again to all of you for spending your valuable time with us today. I am hopeful that you learned a lot, and collectively, I just want to remind everyone that we are addressing mental health care shortages and taking steps to acknowledge the critical role that mental health has, not only in emotional well-being, but also in our physical well-being, which makes the role of a mental health nurse important. So on behalf of our team, myself, and HCAI executive leadership, we really thank you for your participation today. I will now turn it over to Chris to wrap us up.
Thank you, Dr. Shah. We do appreciate everybody joining us today to learn more about the Psychiatric Education Capacity Expansion, or PEACE, Psychiatric Mental Health Nurse Practitioner Grant Program. And we're excited to be able to offer it as part of our health workforce development efforts at HCAI. Grateful for your participation with us today. We do have our resource slides here. You can follow us on social media to stay up to date on all of the things going on at HCAI. Additionally, you can contact us with either by phone or email. And we do encourage you to sign up for our newsletter as well. Please go to our website to discover all of the great resources that HCAI has to offer. As a reminder, the application cycle does close on April 8th, and we look forward to all of your applications. Thank you so much for attending. And with that, we conclude today's webinar. Have a wonderful day.